All right, so for more on this, we joined now in our studio by Cosatu's Parliamentary Coordinator, Matthew Pass. Good afternoon to you. Thank you so much for coming through.
Good afternoon. Thank you for having me.
All right, firstly, just take us back. We know that Cosatu has always been for this NHI bill. Just tell us more. Why do you support this bill?
No, as Cosatu, we strongly support it. We're looking forward to Parliament passing it next year, and we want to see government move swiftly to implement it. Our healthcare right now is in a crisis, both in the public and the private healthcare industry. Workers, members are dying of easily preventable diseases. They're dying of tuberculosis at huge levels. People are dying from cancer, from diabetes, from obesity, things which could easily be prevented or managed, and especially amongst working class people. Our public healthcare is in a crisis. At our public healthcare facilities, we have a huge...
Which is exactly why some people are saying that should we not rather fix our healthcare system before we could go ahead with this NHI bill?
You have to do both. Right now there's a huge inequality gap. We spend 4 times as much on private healthcare costs as we do on public healthcare. The average amount of money spent per person on public healthcare is 4,000 Rand a year. In the private industry, it's 16,000 Rand. In the private industry, we have 1 doctor for 400 patients. In the public hospitals, it's 1 doctor for 2,500 patients. We have a shortage of nurses in hospitals. In the public healthcare industry, we have a shortage of medication, of bed linen, of security, of food, everything. We spend about 200 billion Rand on public healthcare. It's about 4 times that amount in the private healthcare industry. So we have to pull it together. The private healthcare industry only covers 16% of the country. 84% have to go to the public healthcare industries. We can't be condemning our people to live in this kind of poverty, to risking their lives, dying young of early diseases. It has a huge impact upon the economy because workers die young. It means children are left without their parents for easily manageable diseases. So we have to deal with it. And look, we're not proposing something which is unmanageable or impossible to achieve. The national health insurance is based upon models we've seen done very successfully in countries like the United Kingdom, Canada, Sweden, Singapore. Those are good role models that we can do it, and we're confident it can be done if we show the will.
But you have the Democratic Alliance, on the other hand, saying that this is flawed. People are being misled.
Look, sure, the Democratic Alliance is speaking on behalf of the medical industry, which wants to pursue profits at all costs. Our mandate as Cosatu is to support the lives of our members. We have to put people's lives above profit. The fact is that the national health insurance is not based upon what we might have seen in North Korea, for example, not sustainable. It's based upon what we've seen done successfully in countries like Sweden, the United Kingdom, Canada. So unless the UK is saying that those countries are not doing something right, but for us, our mandate is to save workers' lives. The current situation where you have 1 nurse instead of having 6 nurses in the public healthcare industry is not sustainable, where people are dying of cancer at a very young age. Those are not acceptable conditions. We have to do something about it now.
So considering all the challenges that you've just mentioned, Matthew, how do you think the supply of healthcare services will sort of be increased or upgraded to match the demands that we have?
Look, basically, national health insurance means we're going to have 1 single national health fund for the country. You won't have 800 billion Rand going to take care of 16% of the population and 200 billion Rand taking care of 14%. It will be pulled together. It will include the private sector in terms of private doctors and so on, but it will be ensuring that there's equal distribution of resources across everybody. Even right now, most medical aid members can't afford the exorbitant costs that medical aids are charging to consumers. You find people paying 4,000, 9,000 Rand a month for medical aid. It's not sustainable, so we have to pull the resources together. That will enable government, the medical industry, to allocate the right amount of doctors, nurses, resources, medication to our facilities. The other key thing to it is about a preventive healthcare approach. Getting people to go and see the local doctor, going to the health clinic, identifying easily preventable diseases, make sure they are taken care of and managed properly, as opposed to what we have right now, people who don't get diseases taken care of by the doctors until it's too late when they're on the verge of dying or they can't afford treatment for cancer and so on.
But in terms of holding those in managerial positions, for example, accountable, how will this one pan out? Because we know, of course, there are concerns really when it comes to issues around accountability.
Sure. Look, accountability management will always be there. People who are paid to manage must be held accountable. They've got director generals of the departments, they have ministers, MECs, they must do the job. If a manager doesn't do his or her job, they must be fired. It's as simple as that. That's the situation whether you have what you have right now or when you have a national health insurance. But right now, we are simply not providing sufficient funds and resources to take care of our people's life. That's what the NHI is really about.
And we know, of course, that NHI was piloted in some other districts. What are your impressions? Are you happy with the little that was done?
No, we're not happy at all. Government really has been far too soft on it. We have not seen sufficient leadership at a national, provincial or municipal level to make sure things are done properly. And some of the things are very simple things. You have patients waiting at day hospitals from 4 in the morning and they're seen at 6 o'clock at night because of the shortage of staff.
But if you're not happy with the pilot project, why do you believe that the actual project will actually bear results?
You have to do more. We're not happy with the levels of crime in the country. We're not happy with the levels of unemployment. It doesn't mean we stop pushing to sort out our things. People's lives literally depend upon it. Our members are battling on the battlefront as nurses, as doctors, as paramedics. We have to do something about it. The current situation is not sustainable right now, especially given that we are a heavily industrialized, well-developed nation. We have the resources to do with it. As long as we're speaking in a country where you have no resources available, there's nothing you can do. We have the resources available. It's about us showing a bit of solidarity to each other. The funds are also available in terms of the national fiscus, in terms of what people pay currently in terms of medical aids, what the tax rebates people get for those medical aids, and in terms of having a more progressive tax regime. We can do it, and we have to do it. Unless we think right now having people dying of TB at the world record levels is acceptable. For us as Cosatu, it's not acceptable, and when the members are putting pressure on us to get something done quickly.
All right, so you talk about funds being available, and the question really is around transparency. How transparent do you believe the dealings of this NHI fund and related structures will be?
Look, part of the NHI is that you'll have a board which will consist of industry, will consist of representatives from government, from experts and so on, and those things must be transparent. We think, but we do agree completely, given the levels of corruption and mismanagement we have seen in the state and the private sector, especially over the last decade, we need to intensify such things. So we're hoping to see further strengthening in the bill's provisions in Parliament, more transparency measures. We can't afford to see more corruption, more money being lost, because that right now is what has brought us to this economic crisis we're in currently.
And of course, we know of the shortage of health practitioners, more so in your deepest rural areas. They would rather go to the cities for better pay as well. That issue, how will it be addressed by the bill?
Look, that's part of the challenge we're facing right now. Right now, there's a special allowance government gives nurses and doctors to work in the rural areas. It's not really enough, to be honest, because you see a heavy poaching of our medical practitioners by countries like Canada, New Zealand, the United Kingdom. We need to give more incentives to those persons to work in the rural areas. Equally, we must also invest more in the economic activities in those rural areas, because a doctor has a wife or a husband, has children. They need to find job opportunities, educational opportunities for themselves in those rural areas to make it more attractive and exciting to work there. But look, we have to deal with those issues, and government must also be much more proactive and have much more effort given to planning to deal with those kind of issues. Right now you find government is very reactive. It waits for a crisis to explode, waits for things to collapse and people to put pressure on it. This is an opportunity for us to change the health landscape, to provide a much more equal society, to try to overcome the apartheid legacies that we're still battling to deal with. It's a unique opportunity, and we would hope that industry and opposition parties would seize the moment and join us in that adventure.
All right, so tomorrow is the cut-off date for written submissions on NHI, and we've seen again the DA coming out to say that they have received some written objections to the tune of about 100,000. So it's certainly going to be interesting to see how the process unfolds. But from what we are observing now, it certainly looks like it's not going to be an easy ride.
Look, nothing is easy in life, and especially when dealing with huge issues. People dying of cancer is not an easy thing. But we've seen, whilst the DA has mobilized some of its critics to come out against it, we've seen much more broader support from ordinary people who have been attending the public hearings that have taken place in 5 provinces to date. This week is the Eastern Cape, and in January it'll be the remaining 3 provinces of Western Cape, Gauteng and Free State. There'll also be public hearings at National Assembly and the National Council of Provinces. We'll be participating in it. Our members have come out in support of it. And I think also it's important to know that whilst the DA has a right to oppose it, and that's part of democracy, the DA got, 20% in the last elections, barely. The ANC got 60%, basically. The overwhelming majority of society supports the national health insurance, and that's what government must listen to.
All right, so wait and see what happens. So thank you so much for coming through. Matthew Parks is Cosatu's parliamentary coordinator, talking to us about tomorrow being the cut-off date for written submissions on the National Health Insurance Bill, which is NHI.